everyone, welcome to Hope Worldwide. Today let's have a quick review on a subject that is Management of Nursing Services and Education from final year BSc Nursing curriculum. So this is the syllabus book which I am going to follow, that is BSc Nursing degree course and curriculum, revised ordinance governing Rajiv Gandhi University of Health Sciences, Karnataka. Okay. So as we know that the main objective of studying management is to acquire understanding of management of clinical and community health nursing services, nursing educational programs, and also to acquire understanding of the professional responsibilities and contribution to the growth of profession, all those things, right? That's about the course description what I told you. And I have made a checklist, so I'm going to compare or identify the similarities of the syllabus, like fourth year BSc nursing syllabus, management syllabus, with all other higher degrees like MSc nursing, MBA, MSW, and also I've added B.Ed because some topics you study in B.Ed also, because I was teaching educational psychology. So I was thinking, if you study BSc nursing, some subjects and all, it is useful even to teach B.Ed students. Okay, so now let's see about unit first. It's about introduction to management. Okay, so introduction to management, you'll study in all the courses, you study basic concepts of management, basic principles, techniques, elements of administration, difference between administration and management, all basic things you study in fourth year BSc nursing, whereas in MSc you study in depth, whereas in MBA there is a subject called concept of management. Okay, principles, techniques and all you'll study under that, and in MSW again you'll study the basics of management including theories of management. Okay, that means it is under management of social work organizations. Okay, now second chapter is about management process. Okay, so in this you study about planning, staffing, post-scope, every aspect of post-scope in detail. Even in BSc nursing you study that. In MSc you study in depth about budgeting, material management, controlling, PERT, very important topic. PERT is important for both MBA and MSc nursing, okay, including the diagrammatic presentation and all. Okay, so here you study, like in MBA you have separate subjects for HR and marketing, right, and the basics of management. So in healthcare management also we study the different domains like material management, HR, all those things. And in MSW also there is a separate paper, that is HR. Okay, so HR as well as management of social work organization. So you study all this like budgeting, recruitment, staffing, all those things you even study in MSW. Okay, now coming to the third unit is management of nursing services in the hospital and community. Okay, so there you study like what is that, healthcare delivery system, then disaster management. Even in healthcare management you study disaster management. MSW also you study disaster management. Yeah, then leading, delegation, very important topic in both MBA as well as in MSc nursing. You study in depth about delegation, principles of delegation. Yeah, then supervision, very important topic for both three domains, like in supervision, and importance of supervision in social work. Okay, so you study in your final year. Then guidance and counseling, again is applied for all the degree courses like PG courses. And staff development and welfare, it's one of the main important topic in MSW, like employees motivation. Yeah, then like quality assurance model, again one more important topic, like quality assurance model including the diagram, principles and steps of quality assurance model, and its application in healthcare quality management and also in nursing education and nursing management. Okay, so that's about the fourth unit. Okay, coming to the next unit is like, it's about third unit. Fourth unit is about OB, that is organizational behavior. OB is one of the main subjects in MBA curriculum, actually, organizational behavior, whereas in fourth year BSc nursing you study little basic things about what is organizational communication, leadership, then group dynamics, etc. Whereas in MSW and MSc nursing you study application of group dynamics in social work or in nursing education as well as in nursing management. Then also you study about public relations in context of social work in MSW, whereas here you study about collective bargaining both in MBA as well as in MSc nursing. What's application of group dynamics in collective bargaining, or teamwork, etc. you study here. Okay, so that's about the fourth subject. Coming to the fifth subject is in-service education. So in MSc Nursing, in BSc Nursing, you study the basics of in-service education and what is the principles to be followed, and how do you conduct an in-service education. Whereas in MSc Nursing, you have to conduct an in-service education as part of your practical requirement. Then even in MSW and MBA, it's a part of employees motivation training program. How do you conduct a training program for the employees in the healthcare organization, etc., right? So that's about it in service education. And how do you document it, how do you report this, and how do you make the continuity of in service education? All those things you'll study as part of healthcare management. Okay, then coming to the next chapter is like unit 6, chapter 6, management of nursing educational institutions. Like you'll study about INC norms, affiliation, accreditation, all governing aspects you study here. Okay, then including accommodation facilities, budgeting, then equipment and supplies, clinical facility, transport facility, all those things you study here in BSc level. But you will study in depth in MSc level, as well as you will get some practical exposure to management of nursing educational institution. Like, you have to write course plan, lesson plan, all those things you study here. Yeah. Whereas here in MBA you study about management of healthcare organization, like hospital core system, healthcare delivery system, all those things you study in depth. Okay. Whereas in MSW you study about management of social work agencies, like how to run an orphanage, what are the legal principles to be followed to start an NGO. Okay. Then what are the legal principles or formalities you follow in juvenile home, what are the documents you keep there. Okay. All those things you study here along with your field work practicum. Okay. So that's about management of social work agencies. And in B.Ed you study about management of organization, educational organization, including management of school, colleges, etc. But still classroom management is different from this. Okay, classroom management comes under educational psychology. Okay, so that's about it. Then unit 7. Unit 7 in this nursing as a profession is a wonderful topic. You study in from your UG, like first year you study in your nursing foundation. Again, you study the same subject or same topic in your 4th year BSc, okay, as part of your management. Once you start pursuing your MSc nursing, it's a part of 2 subjects in first year. That is, you study this under advanced nursing practice and also under nursing education. Again, you study in second year as part of nursing management. Okay, so nursing as a profession, first year you study only the criteria and all, qualities of a professional nurse, etc. But in 4th year you study the professional guidelines as a profession, and as a nursing as a profession, why it's called as a profession, what are the criteria. Again, you'll study a lot of things like what are the constitution acts and all related to this, consumer protection act. That's very important topic for MBA and MSW. Okay, then one of the repeated asked questions in MSc nursing is current trends and issues in nursing. So it's from this chapter. Okay, again, governing bodies in detail about its objectives, all those things you'll study here. Fine. Then unit 8, the last unit is professional advancement. Okay, so professional advancement is applied everywhere in all the discipline. Like in 4th year you study about continuing education, career opportunities, collective bargaining, again it's repeated here. Then participation in research activities, and you'll get an intro or you'll get some base about professional advancement in 4th year, final year BSc. Whereas in MSc you have to participate in all those. You'll have to attend workshops, conduct workshops, and and you need to conduct a continuing education program, all those things here. That's about MSc nursing curriculum. So whereas in MBA professional advancement you'll study about various opportunities and trends in healthcare management or healthcare delivery system, all those things you study in depth. Okay, what are the different opportunities for a healthcare manager or hospital management and its influence in quality healthcare, all those things you study here. Whereas in MSW again you study extended and expanded role of a social worker. Okay, and what are the professional guidelines you have to follow to provide services to the community as a social worker, all those things. Again in teaching also you'll have to update professional advancement principles about educational aspects like both teaching and learning. Okay, so that's about unit 8. So I think 4th year BSc nursing, this syllabus actually management is a useful subject. If you want to continue your education in any other field like management or social work or so, it's very useful apart from MSc nursing. So I hope it's a useful video. Thanks for watching. Bye bye.